People's Health Trust supports local people to make their neighbourhoods even better places to grow, to live, to work and to age. And we do this because where you're born and where you live and where you grow up have a powerful effect on your long-term health.
Health inequalities in this country means that somebody in a disadvantaged area will live 7 years less and will have 17 years potentially with a disability compared to somebody in an affluent area.
A number of organisations focus on the big killers in society, so cancer, coronary heart disease, diabetes. It's all very important. But in 2008, the World Health Organization recognised it was the underlying social, the economic and the environmental factors which really resulted in people dying younger. And critically what they said was that local people needed to be in control of the decisions in their local neighbourhoods. So what was exciting about working with Penparcau Community Forum was that they were already an established local organisation, and what they needed was support with an engagement process to really come up with local priorities.
Penparcau is really a large suburb of Aberystwyth and hasn't always had the best reputation. There were even curfews in the village, to be honest with you. Anyone under 16 years of age had to be indoors by 9 o'clock. It had got to that point.
The People's Health Trust funding really made a difference for us to enable us to really ask the community what is needed in Penparcau to make it a better place. What we did with all that information was create the area plan, which involves mainly the community centre, and we've now applied for funding to extend it. The other priorities were a community minibus, statutory buses. They don't go to every corner of Penparcau. For me, what inspired me was that most of them said they want to see things happen for our young people. They want to see opportunities happen for them. They want to see them upskilled. They want to see them having some fun. The funding that they received included a small pot of money to disseminate it into the community as a little grant scheme.
We gave some money to the guides, the scouts and the angling club. We invited them to an interview. We'd ask them questions like, how will this benefit the youth? What are you going to do with the money? Why do you want it, basically? Till the forum came together, it was quite a boring place. All we had was the park. Now we have youth clubs, we have the events we hold here.
They talk about Penparcau now as the place to be. You're getting the youngsters who are involved in the youth forum who start to feel that they're part of that nice place to live.
It's nice to know that the youth can still have power whilst being children at the same time.
We will look for the older ones to become role models for the younger ones, and as the older ones slip away from the youth but into the senior forum, and then there's the next lot, and you have this continual sort of rolling production line of more enfranchised people, people who've given the confidence to have a go.
In 5 years' time, I hope to be in the senior forum as a director.
Just engaging, you cannot put a value to it. You cannot put a value to it. It's so high.
When you see control shared and kind of a collective engagement, you get a real buzz and a real sense of excitement. And you see people on the grounds who, often haven't really been involved before, who really light up and really start to think, there's something different here, there's something exciting here.
Working with Aspire and Succeed was really exciting because this was a really small organisation with really big ideas, and what they needed was some time and some money to be able to develop the priorities that local people were already starting to talk about.
Well, Aspire and Succeed come out of the 2005 riots that we had in this neighbourhood. Some young people lost their lives, so we looked around and we thought we really need to do something. Lozells historically has had major investment in the neighbourhood. A lot of the money was not invested in infrastructure or capacity or training people in the neighbourhood. That's where Aspire and Succeed is different. Our organisation was about making little changes in people's lives but having a big impact. People's Health Trust approached us to have a conversation with our community and our neighbourhood about what the real issues were. Then they invested in our organisation in terms of tackling 3 main priority areas. The first one was children and young people. We had jobs and money, and then there was environment and safety. Environment's a massive issue always in our neighbourhood. You know, every road you walk down, there's a mattress or someone dumping something. Wherever there was a no dumping sign, there was dump.
Our children couldn't actually play in the parks because there were people doing drugs, razor blades, needles, things like that being dumped. So we were kind of concerned that there was nobody actually overseeing that at all. You know, we all had sort of ideas of what things concerned us, but it was just actually trying to find solutions to that.
The funding from People's Health Trust employed a community warden for us. We wanted someone local who understands the issues, who's been dealing with these issues himself.
We're here long term, trying to make a difference, working from grassroots all the way to the top and trying to find out the main issues that we can tackle together. We're building a relationship with the local street cleaners, Carlos and Mike. They know every road inside out and they know every grot spot. They work with their line manager. We actually have him on a neighbourhood tasking group, so we hold him accountable, and if he can't do something, we then go to the hierarchy above, which is their head of office. So we built a link between all 3 of them, rather than just working with certain sections of that waste management. We've set up an action group with the local residents of each road. What we've noticed is each road does have people that care. It's about finding those people and connecting with them.
Just having somebody there to deal with your problem, someone that, you know, will take it further. And it, to me, drug dealing and whatnot, visually it's gone down. It really has.
Change generally happens slowly. The issues that we have, you know, we could minimize it, but I don't think we could ever eradicate it.
If I can empower more individuals to come and collectively take responsibility and ownership of their area, there wouldn't be need for somebody like me long term. We just need to identify the people that have the passion and just give them some sort of direction, right? And then Lozells will blossom.
Local people know their own issues and their own needs often far better than professionals going into a community can do. And so often what we find is very well-intentioned, well-meaning people who come in from outside the communities and who are parachuted in and attempt to fix communities and find solutions. But because they don't really have any understanding or any real connection with local people, so many of those intentions miss the point really and never quite get to the nub of the issue.
When the opportunity came to work with the residents in Naylorsfield, we jumped at it because what was clear from the application was that local people were very much in control of the idea of using disused space and coming up with a future plan for it.
A lot of the people that have lived here since it was built in 1964. I work in the local club, St Cyril's, I'm the manager. The square that was in front of the club was an eyesore where everyone used to hang around and they dump rubbish.
We've got shops here, a social club, a community project, and people were frightened, I think, to cross the square.
We approached the council. Well, they said, what plans did we have for the piece of land? And then I put it to the residents on the estate. We had a little meeting in the club. We decided from there that we would then start the memorial garden. Eddie and Albert said, right, we'll come and help, and they've never left. They've been here every weekend for the past nearly 12 months. Other residents would come in and say, right, I can do this and I can do that. And so it was them who came to us and said, what help can I give you?
Alan, who designed everything, he'd tell us what to do. Sometimes I'd be doing fencing or painting. Taking the flags up was very hard. I couldn't pick them up at first when I first started. But now I've got a bit stronger, I suppose. My lad got married in this church. That was the only time I went in the club, though I lived right by it. I always went to where I used to live, down that end. Donna invited me to come over, and she told me he would like to do something for my wife, Maureen, which was put a bench in and put a plaque on the wall.
Maureen was the warden of St Cyril's Court, because Maureen did a lot for the elderly on the estate. And I think it's good for Eddie as well.
When I lost my wife, I was really down, but it's still emotional to talk about it, but these people helped me through that. You know what I mean? They really did. I'm so glad to get involved, and I've really enjoyed it. I really have. I'm happy, really. You know what I mean? and I've got good friends now.
From 7 o'clock in the morning, before people go to work, they'll come here. They come overnight time, they come at dinner time. People who haven't seen each other for a long time will come and sit on the bench and have a little chat. We won an environmental award from Liverpool Echo, and we thought, oh, we've got no chance, we're just a little community. Anyway, we won, and we got the award.
It's given local people a greater voice because people want to listen to them now, simply because of what they've already done for themselves.
Collective control works because it breaks down isolation. People don't feel that they are responsible for their own situation. They begin to see the wider picture. They begin to connect with networks that they never had before, that can actually help change their lives and their neighbourhoods.
One of the things that's exciting about People's Health Trust is that they do have a real commitment to actually investing in local people, and so often a lot of funding applications you see that there is a requirement to consult with communities, but there isn't the same commitment to real involvement and real engagement and putting local people in control. That's something that's really quite different about this particular pot of funding.
If local people are to make the changes that they need at their neighbourhood level, they need space, time and resources, and critically they need to be in control of those changes. It's only then that we will start to address some of the growing and avoidable health inequalities in Great Britain today.